Back. I feel like we've said this so many times, but it's true. This has been a really big week in the pandemic, especially numbers wise. Case numbers in Oregon have massively increased, and that is not an exaggeration. We have broken the record number of cases for one day 4 times in the last week. 4 times. Yesterday, the Oregon Health Authority reported 7,615 new cases of COVID-19. That's the highest ever. And the previous record for reference was set, well, the day before that. More than 6,000 cases. Last Thursday, 1 week ago today, the record was a little over 3,500. And at the time, those numbers seemed huge. As you can see, though, we've blown those to smithereens. So yes, cases are going up. That is abundantly clear. But how alarmed should we be? A lot of you are wondering that. We got this question from Donna. She wrote, along with so many others, I'm tired of COVID. I've been vaccinated and received a booster. If this new version, Omicron, is more like a bad cold, she wrote, what's the big deal? I have not heard of anyone dying from it. Donna, thank you for writing in. We get it. We're tired of COVID too. I think everyone is at this point. If you're not, please write in and explain why. But being vaccinated and boosted, like you, Donna, and like me, is a great start. And it is the best thing that can protect you right now as cases rise. But there are a few reasons to keep paying attention to what's going on. First, there's the idea that the Omicron variant is just a bad cold. Our local health experts today said that for most of us, that actually is going to be true.
Most of us, I think, are going to encounter Omicron, and most of us will have mild or no symptoms from Omicron. So those of us who are younger, who have protection from vaccine, especially if we're boosted, excuse me, are going to be more likely to have either no symptoms or to have mild symptoms like a cold, recover at home with no problem.
So there you go. For most of us, Donna, that is the case. Most. Because unfortunately, Dr. Vines didn't stop there.
Some of us, relatively few of us, may get severe disease from Omicron. And the way the virus spreads so quickly means that it can very easily find the people who are going to be most at risk for severe disease. And because it's going to spread quickly, those who end up needing hospital level care might be relatively small in number, but they're likely to all need care at the same time. And so when we hear about OHSU modeling forecasts showing a high number of people needing hospitalization by the end of this month, those are the unlucky and the high risk who are going to need hospital level care at right around this same time, which is going to really strain our hospitals.
And keep in mind, that can include kids, it can include immunocompromised people. So again, there are those who are at risk. That brings us to Peter's comment after he tweeted about the increase in case numbers. He wrote to us, yet no spike in hospitalizations. Peter, we appreciate you weighing in. Unfortunately, that point is incorrect. There was a rise in hospitalizations and deaths during the Delta surge, and we're starting to see a rise in hospitalizations with this current surge. It always takes a little while. Data kind of lags behind. But right now we have 588 people in the hospital with COVID around the state, and numbers have been rising with the rise in case counts. So both are going up. Dr. Vine says hospitals are already starting to see that strain.
Unfortunately, after several weeks of hospitals slowly going down after the Delta surge, we're just starting to see or hear about an uptick in hospitalizations of people. We can't say if those are Omicron related or still Delta. It's impossible to say exactly, but it is cause for concern given that our hospitals and health systems are already under intense strain. And by that, I mean EMS calls are up 40% over a usual average volume, and at least one Portland Metro emergency department, a large emergency department, was physically out of space at one point yesterday afternoon.
And it's not just people in the hospital who aren't vaccinated, because I can see why you would assume that. During the Delta surge this fall, we saw an increase in people dying from COVID after they had been vaccinated. It peaked at 192 people in September. Right now, at the same time, right at the same time that case counts peaked. So both peaked at the same time. The OHA says more than 600 people have died from COVID-19 after getting the vaccine. And that was always likely to happen. Breakthrough infections happen, and they always said that was possible too. More than 2,200 people have had to go to a hospital with a breakthrough case, period. And the median age for breakthrough cases is 46 years old. The majority of breakthrough deaths have been people over the age of 70. Now, aside from the sickness and aside from the hospitalization and the deaths, as if that wasn't enough to think about, Dr. Vine said we are going to start seeing disruptions in society from people getting sick and people calling out sick from work, and then those companies being unable to perform services. We saw it with air travel during the holidays. We've already seen it in a big way, as we said, with flights being canceled and delayed across the country as workers were calling out sick. Maybe you've noticed it in your workplace too, or workplaces that you've been encountering. So send us your questions and your comments. Let us know what you're seeing. There's obviously a lot to talk about with masks and with testing and with gatherings, and we are talking to the health officials so we can bring your comments and questions to them. So as always, email us at thestory@kgw.com or use that hashtag #TheStoryKGW on Twitter. We're going to finish the show next.